Welcome to another edition of Revive and Thrive. This is episode number 22, and I'm your host, Joshua Blum. Today's episode is brought to you by the letter V. We've been going through the alphabet one letter at a time, each episode for a different letter, and today is V for visualization. All of our episodes have to do with one specific topic related to physician burnout, specifically for fathers. And today's episode is one that is not just for that. I mean, many of the episodes we talk about are much more widely applicable than for just physicians or just fathers. But today's one has a lot of different parallels to numerous other things. And that's the idea of positive visualization to affect change. And by this, I mean that in order for us to make changes in our life, sometimes we have to see it in our mind's eye first for it to actually happen. One of the things that happens when people get burnt out is they can't necessarily see a future for themselves. They feel like they're going through the day, each and every one, it's a grind. And they're going through the motions, but they've lost sense of where they want to go because they don't necessarily see an immediate impact of what they do. You know, it feels meaningless. And also that leads them to feel kind of trapped. And so from that, you get this idea of like a rodent running on a wheel. If you stop, you're going to flip around and maybe fall off, but running, you can only do that for so long, right? So positive visualization is something that I first learned. I think it would probably be from a book, actually. And if any of you have been involved in martial arts, you may recognize a book it's a few decades old at this point, but it's called Zen in the Martial Arts. And it's a good read if any of you are interested in that sort of thing. For the people that are mentioned, people like Bruce Lee and Chuck Norris and so forth, it's dated because it was written decades ago. However, the information is still good, has not really changed that much. There's a chapter in the book, and I believe it's a chapter called Confident Seeing. And it's a chapter where it's a story where someone breaks his hand. He was doing a demonstration, breaking cinder blocks with a punch, and he takes on too many blocks and he breaks his hand in the process. And he sees a doctor and he's basically told that, you know, you're lucky to have a hand and, forget about doing karate or whatever. And he took that to be, okay, that's fine, but I think I can probably do better than that. And he visualized what it would be like for his hand to be fixed. And I think he visualized like little workmen. Like every time he would go to sleep, beforehand he would visualize like little construction men working on his hand, stitching it back together so that it was knitted whole again, the bones. And he'd shattered a bunch of bones in his hand. And he went to see the doctor afterwards, and his hand was together, and a lot sooner than they anticipated. But it was stiff. There was a fair amount of scar tissue, and so he next visualized for a period of time those same little men, working on his hand, but their tools had changed. Instead of construction stuff, it was now sanding and stuff to lubricate the areas. So long story short, he healed a lot sooner than his doctors anticipated for such a series of breaks. I think it just goes to show that when we have a focus, we often can accomplish things we don't necessarily think that we can. I think we all have stories from like this in medicine. People who want to get better will get better, but people who don't want to get better probably won't get better. The mind can do all kinds of interesting things like this. I was, when people ask about medicines, we often talk about the placebo response. Often drugs are tested against placebo to make sure that there isn't just a placebo response, when sometimes you can't necessarily tell the difference in the beginning. The other thing is that, oddly enough, people will have side effects even in a control group often. They'll have various kinds of side effects. So it just goes to show that how we think about something and what we think is going to happen is not insignificant. The opposite of placebo is something called a nocebo, which basically means if you think it's not going to work, it's probably not going to work. There's a good chance it probably will not. You'll find a way not to have it actually be significant. I don't know if that necessarily applies for all things, but I think it could apply conceptually to some things, like medication is not going to work if you don't take it, right? So I think we all know examples like that where someone is prescribed a medication that seems reasonable, but for whatever reason, they don't fill it. they don't take it long enough, they don't take it consistently enough for it to work. Taking a pill seems like it would be very simple. However, it's obviously not that simple, as any of you who practice clinical medicine know. Now, maybe at some point in the future, we'll look back on the way we deliver medication and think about how crude it is, but at this point, that's what we have. And so these factors very much are at play. One of my favorite stories about this comes from, again, it's another martial arts example. In 1988, Taekwondo was going to be a demonstration sport in the Olympics in Seoul, Korea. One of the people on the U.S. team, her name is Dana Hee. She was in the training center. I think this probably was in Korea. So she was on the U.S. team, and she was training with a bunch of people, in sort of the prelude to the Olympics. I mean, it was just to get acclimated to the environment, basically, in the Olympic Village or whatever. And so there was I don't know how long, maybe not very long, but maybe a couple of weeks of training just to get acclimated and settled. And she injured her back actually during a training exercise. Olympics were just a very short period of time away, and anything she would do would exacerbate her injury. Taekwondo is known for a lot of kicking, and you're laced up in this chest protector that will kind of compress things a little bit, but I mean, you still have to move very fluidly. And so she really could not train. And so what she did instead, and I think this is a testament to being flexible in these situations, is she trained mentally. So she would go through things that she would do mentally rehearsing her strategies for her matches, and mentally rehearsing what she knew she could do, areas that she had difficulty with. And she would picture those things going well. She would picture herself executing the techniques flawlessly. She would picture herself winning her fights. On the day of the competition, she got patched up, I guess, as best she could. And bottom line is she won her fights. There were certain things she could not do because of the extent of her injury, but she did enough in order to win. And I think that's a great example of how sometimes things don't always go as planned, and we can't always do the things we typically do, but that doesn't necessarily mean we have to totally stop doing it. What we kind of will do what we see ourselves doing. And so one way to work on a particular skill, or one way to affect a particular outcome, is to at least be able to see yourself doing it well, doing it successfully in your mind, even if that's the only thing you can do. The title of that chapter in the Zen and martial arts was called Confident Seeing. In other words, being able to see what you want in your mind's eye first, because if you can see it, there's a good chance that you will then be able to do it. We do, in mental health, we do a version of this, a lot of different versions of visualization. So there's a lot of different offshoots of this, but one in particular. So people who have had traumatic experiences of various kinds will often have nightmares. So re-experiencing something again and again is typically part of the post-traumatic stress response. And it will happen at night as well. And so what ends up happening is that people often will have all kinds of sleep problems and may even, in fact, not want to go to sleep because they're worried about the nightmares. And where they do sleep, they have very disrupted sleep because the nightmares happen. And so there's a technique that is it's actually used to work around this. It's called imagery rehearsal therapy. It's basically a fancy way of saying that this works for dreams that are sort of recurring, like there's a recurring theme or a series of events that typically happens. And what you do is that you kind of look at that and say, like, okay, I'm going to try to change the outcome of a part of this dream to be more positive, where I have more control. And basically, you're almost like a movie, like a script writer for a movie. And you're writing down all the details that you can to really put yourself in the waking hours of that dream. So you're rewriting the dream so you have a positive outcome, and you're really trying to get into it during the day, examining all the different aspects of it. And then what you're doing is that you're rehearsing it over and over and over again. So you're loading it into your consciousness so that by the time you get to nighttime, hopefully you're unconscious mind will then choose that, or has a better chance of choosing that than the other outcome, which is the negative one. It's something that works really well. I've done it with a number of folks. If you are interested in doing it, I'd say you can look up imagery rehearsal therapy, or IRT, and just learn more about how it's done. It's really not a very complicated thing to do. Once you explain it to people and show them kind of how to do it, and it works, they're like, oh my God, they get this sort of empowerment out of being able to do something. It didn't even require a medication. And I think it just goes to show, again, this variation of being able to see something positively and how that can make changes actually in the world. So how does this apply to us as physicians? I think one of which is, if you have anything that could be dealt with in this particular way. Maybe you are struggling with bad dreams. Maybe you're struggling with something that you don't know how to do, you can't do very well. Something that you consistently have had trouble with, like, I don't know, for example, maybe you're a very shy person and you really struggle with interactions with people. And that makes work difficult, or maybe you're in clinical medicine and you struggle with that, for example. Being able to picture yourself doing those interactions well is the first step. Maybe it's some kind of skill that you are working on. I use a lot of this stuff to maintain various skills when I can't actually practice them. For example, I was a gymnast in college. I'm getting older now. I can't do some of the same things, but I actually use visualization to practice some of those things that I can do, that I want to maintain. And it's part of sort of my nightly routine. It's sort of an active meditation, I guess, if you will. Maybe there's certain things that you want to work on. For example, like there's a procedural kind of skill that you're learning how to do, and being able to do it the same way each time. I could see this working for something that's procedural, like a medical procedure or an operation or something like that, where there's a specific set of things you're doing and a very specific technique that you're doing that you want to rehearse, that if you do it wrong, it's going to affect the outcome. But if you need to practice it, and you can't always practice it enough to be fluid in it. How many times do you really get to do certain things, for example? So if you can practice it in your mind's eye and go through the motions of actually doing it in either, I think, first person view or third person, or varying your points of view so that you're seeing it from different angles, I think that is actually a pretty good way of recreating this whole thing. So I think there's a lot of different applications for that in your day-to-day life. I think it's really just limited by your own imagination. So sometimes when people say, get your head out of the clouds, I think that is, they're well-meaning, but I mean, there's a lot you can actually do with the power of your own imagination. And I say that because often when we are feeling particularly downtrodden and burnt out, that is when we actually need our imagination the most. So I'm going to leave it at that. Thank you for listening. I will talk to you guys next time.